So for them, like in terms of, where you talked about your clinical interactions and how you're breaking the barriers or how you're generating or building that trust, have you seen that happening on social media with your audience?
I was actually pleasantly surprised because when I started, my goal was I started kind of here. I mean, I trained here. I was born in Bangladesh, but I've been here since I was 17 years old. So when I started, I didn't necessarily think that I had an idea, but that wasn't on the top list. And then, of course, as I started to do it, a lot of family members, friends would be like, you should really consider doing it in Bengali. And I did. But what surprised me was I didn't know what to expect because, again, there's a little bit of that cultural taboo, and I deal with a lot of very sensitive topics. The amount of outpour of questions that I get, and they're very specific Eurogyne related questions, not just random questions like, oh, I have a fever. What do I do? They're very specific questions. The repetitive theme is that I couldn't find anybody here who understands it. Or, like, I told it to my gynecologist and they're saying, well, this happens, just deal with it. Right. And I get it. Like, I'm not gonna blame the physicians in the eastern part of the world because there's just the volume is incredible, right? I mean, you think about like there's a billion people in India. Like Bangladesh is a small country and there's like so many people. So I can understand, just like we were talking about before, like our primary care physicians here. But I think it's also a lack of knowledge. Like I've actually had, physicians or healthcare providers come and be like, like I am a rural health physician and thank you because I'm learning so much too that now I can use to help my patients. So that part has been really incredible.